Hi, I'm Lakresha Daniel, Claims Adjuster and Risk Manager here at AlaCOMP. Today I'm joined with Tony Bridges and John Concetti of Therapy South, and I'll just let you two go into your roles here at Therapy South.
Okay, my name's Tony Bridges, and I'm the Director of Industrial Rehab for Therapy South, and that's what I do: FCEs, work hardening, job test, impairment ratings.
And I'm John Concetti. I'm a LPTA with Therapy South. I'm also a work comp specialist, and I assist Tony with some of his work conditioning, FCEs, and I do all of the physical therapy for our workman's comp patients.
Great. Today we will be going over FCEs, which is functional capacity evaluations, the polylift system, and proper ergonomics in the workplace. Guys, could you explain what an FCE is and why it's important in the workers' compensation process?
Okay, so an FCE is a test to determine if a patient is ready to return to work or not. And really, that's the bottom line. It's going to test their overall function, and the physicians are going to use it. Of course, the insurance companies are going to use it, but it's to give that clearer picture of where this patient's at.
Okay, awesome. How does an FCE help determine if the injured worker is ready to return back to work safely?
Well, because it's going to go over all the physical characteristics of work. It's going to determine their physical demand level, which is how much weight they can lift, push, pull, carry. It's going to address, like I say, all the physical characteristics, how much they can bend, squat, kneel, climb, and those type of things. And those are the things that the doctor needs to know in terms of returning them back to work.
Absolutely, absolutely. What specific tests are included in the FCE and how does it relate to their job duties?
So there's a battery of tests that are done, and kind of depending on the diagnosis, that's where the test will veer off, as well as the specific job duties. But there's a battery of testing that everybody's going to do, and it's going to cover everything from floor to overhead and everything in between. And it's going to cover the basic essential functions, such as bending, squatting, kneeling. Then the test may veer off. For example, if it was an ankle injury, we may do a series of ankle-related tests. If it was a truck driver, we would definitely do like a climbing test to see how high they can climb to get in a truck, if they're able to do that. So while there is similarities with all the tests, the test will take a veer depending on the diagnosis and the job demands.
Okay, perfect. So once this FCE, functional capacity evaluation, is complete, does the employer get a copy of this? The insurance company, do they get a copy of this? What should they expect?
So we'll send a copy to the doctor and to the insurance company and the case manager, and the employer, of course, will get it from you guys.
Okay, so what should the employer look for when they're reviewing that FC report, when they receive it back in their hand? What should they look for on that functional capacity evaluation form when they return back in hand with that to their employer?
Yeah, that report, can be a nightmare for people. So, if you get that report back and you're looking at something very thick with a lot of pages,
Absolutely.
That's not what you want. It's going to be a lot of garbage in there, frankly. You want to be more concise and to the point. Like with our FCE, it's about 4 pages long, 4 or 5 pages, and really you can get to the meat of it really quick because we have a PBI rating. So what should an employer look for? You want to look for the bottom line of what was achieved on the FCE. Did they give good effort or did they not give good effort? And this is a big one. A test has to close out with some recommendations. I mean, you have to make a call of this person's ready to go back to work, they're not ready to go back to work, or whatever the situation may be. But you got to get to a conclusion and a recommendation. So, like I say, a lot of garbage and a lot of tests, and a lot of tests are around. And you just got to choose, and you always hear this word, you want the one that's going to be the most objective. And so
Right.
how do you determine that? You know, we'll talk about that a little later.
Perfect. Thank you. Those are some great insights on the functional capacity evaluation. All right, Tony, John, we're moving on to the polylift system. Can you describe what the polylift is and how it's used in therapy?
So the polylift system is basically a lifting machine, and lifting is very subjective. So the primary purpose of the machine is to help in determining true safe efforts for lifting and whether good effort is given during the lifting test. And again, it gives much more objectivity, something we were talking about a few minutes ago, as opposed to just actual visualization or something. We're actually getting real numbers in terms of real time with what's going on with the lifting.
Okay, perfect. How does the polylift assist in evaluating and rehabbing the injured employee?
So we really feel like with the polylift we can get a true, for somebody given true maximal effort, we feel like we can get very accurate numbers, because what it does, it tests velocity and acceleration, and that's kind of the big thing now in lifting. Not only here, but just in the world of sports, that would be the biggest thing. Everybody uses velocity to determine everything, and so that's what we're doing here. So not only can we determine what is safe by what kind of velocity they're achieving, but we can also determine people that aren't given true effort, looking at their velocity throughout the test at different percentages of max and that type of thing. So and in terms of using it in rehab, I mean, it's a great thing to watch somebody's strength increase over a period of time, because let's just say we're lifting 40 pounds, and when I first get them, their velocity might be 12 inches per second. By the time I'm through it with them at 40 pounds, now their velocity is 40 inches per second. So we have something really objective we can track there.
Perfect. All right, thank you. That's some great information on the polylift system. Thank you for
Thank you.
taking the time to go over that with us. What are some common ergonomic mistakes you see in the workplace that contribute to injuries?
Well, some of our most common, of course, you have low physical demand settings like the office job. Of course, you want to make sure your computer monitors at eye level, feet flat on the ground, and your back sitting upright in a chair. But as far as our more physically demanding jobs, which we get a ton more injuries in these departments, the most common issues are lifting techniques, pulling and pushing.
All right, for workers in those physically demanding jobs, what exercise or stretches do you recommend?
Well, you get most of your activities involve your back. So all of pulling, pushing, lifting, carrying, a lot of it has to do with your back strength. So oftentimes when people are picking up objects from the ground, they're not utilizing their body in the right way. You hear it all the time to lift with your legs and not your back. Well, you'll be surprised at how much you see that even after instruction and training, that just kind of goes out the window sometimes, especially the heavier the load gets. It seems like a lot of workers out there, they're hesitant to ask for help, and so they'll just go ahead and try to manhandle it themselves, and you know where that leads, right into our office.
Very true. All right, what are some simple ergonomic adjustments workers can make to prevent the risk of these injuries?
Simple adjustments would be making the job easier for you is a kind of a baseline you want to start with. Whenever you're carrying objects, you want to hold it close to you.
Okay.
If something is, if you're going to pull something and it's not feeling like a smooth, easy pull, try to avoid the urge to start wrestling with it and trying to twist your back. Of course, twisting your back is a high risk for an injury for your back. You always want to make sure you're facing the job of whatever it is you're doing and you're not twisting at your torso while you're carrying something heavy.
Okay.
Now let me just add one real simple illustration to exactly what John was saying.
Okay.
I'm going to put this weight here in 10 pounds. There's a 10-pound weight.
Okay.
So if I have this 10 pounds right here, it is 10 pounds. When it's here, it's now 50 pounds.
Okay.
Okay, and so somebody thinks all the time, well, this weight's nothing, and it's not a lot, but out here it is a lot in terms of the stress it's putting on your back and your neck and your shoulders and everything else.
Absolutely.
So, yeah,
Absolutely.
closer the better.
Thank you
Closer
for
the
that.
better, that's absolutely true. Sometimes making the height more comfortable for you as well. For example, if you're having to get down and work down low, you can grab a pad or something to kneel down, or a stool and sit down and work at it, so where it's more of a comfortable height. Same thing with a ladder. If you're climbing up a ladder and you're having to get to the top rung to reach whatever it is you're going for, go get a taller ladder.
Okay. As far as like that pushing and pulling, would you like to give us some examples?
Sure.
Can you demonstrate it for us so that we
Absolutely.
have a better understanding of that?
Absolutely. You know, here we have a sled, which it gets used almost more than any piece of equipment in here. But, you know, pushing and pulling is a very common workplace function. So, you know, a lot of times people will get behind a heavy load and they'll try to get their whole body behind it like so, rounding out the back, which is going to cause that high risk for injury. With all of our exercises, a common theme you'll hear is locking in your back, okay? So you always kind of want to get your back locked in and use your legs to push you forward.
Okay.
And same with going backwards. You want to lock your back in and kind of use your legs for leverage to help you pull forward, as opposed to rounding out the back, once again making it more susceptible to injury.
Okay.
The same thing could be said with lifting.
And John, tell them about pushing and pulling, just a common point, with pushing the weight, stronger leg in back, with pulling the weight, stronger leg in front.
Sure, that's a great point. You know, to push, you always kind of want to get your strong leg behind you. And if you try to push yourself with all your might, you almost will instinctively go into that position to get that leverage behind you. And same thing with pulling. You want your stronger foot in front of you to kind of get that leverage off for you.
Okay. Great.
With pushing and pulling, you know, we have here a sled. This gets used almost every day in our clinic. Most common mistakes with pushing and pulling is, once again, going for that rounded back position and trying to push the load that way, and same with the pulling. Sometimes people round their back out and try to pull that way. That will lead to an injury someday. So the way you want to do it is, just like many of our maneuvers that we're doing in here, you want to lock in your back and use your legs to help push the load. So you're going to kind of lock in that back, and you want to get your stronger leg behind you, and it'll really help you to get that leverage to start the push. And oftentimes with pushing, once you get it started, it kind of pushes itself after a little while. So get that strong leg behind you, back locked in, and push forward. And same thing with pulling backwards. This time you're going to get your stronger leg in front of you, lock in your back, and start to pull backwards using your legs. Okay, here we have a box, which, let me get this in view. All right, box lifting, another extremely common task in the workplace. You want to get as close as you can to it, kind of widen your base of support. First thing you're going to do is bring your hips back and keep your back straight. Okay, it's the most important thing, once again, to lock in that back. So you're going to come down and keeping the back straight the whole time. Keeping the load close to you is also very important. Like Tony was saying earlier, this out here weighs much more than this here. Same thing on the lift down, like so.
And when John lifted that, straight vertical line here, if you've ever seen a weightlifting contest, those guys have their whole upper thighs chalked. There's chalk all over it. The reason being is when they're lifting hundreds and hundreds of pounds, that bar is going to come so close in a vertical plane, it's going to hit there on their thighs. And that's what they want. That's what they want to accomplish. So in industrial lifting, you want that same vertical line, straight line up there. So, and I was watching the position of his legs, and they were perfect. So, yeah.
Sometimes it's about setting yourself up for the lift also. If you come up to the box like so and your feet are close together behind it, it's going to force you to do this to get to it. Even if you squat down, it's going to hit your knees. It's going to throw off your technique. So make sure you get nice and close to it, like Tony was saying, right over it if you can, and lift it very close to you.
And staying flat-footed is also important, yeah.
All right, in closing, how can employers incorporate ergonomic training into their workplace safety programs?
Yeah, so I'll say this, like I'm a certified ergonomic evaluator, and I think this is like probably the most underutilized service we have. I mean, I can remember back in the day, I was called into industries all the time to do job analysis and look at the jobs, look at what the risk assessment was, and it's like nobody really goes to that point now. But I think to have a good workplace safety program, it all starts there in understanding what the job entails. You would be shocked to know, like, how many supervisors in a factory really don't know the physical characteristics of the job they're supervising. You know, they may say, well, they don't have to lift but 2 pounds. Well, but they might be lifting that 2 pounds 22,000 times a day, and that makes a difference. Or they don't have to bend that far, but they're bending at a 35-degree angle 3,000 times a day. So once you understand that job and know that job, you can better do a workplace safety program because you can address those factors with the worker. And you know, so we have those services available at Therapy South for sure. We even have an on-site program where we go on site so many hours a week for those various reasons. And of course, you know, I'd be remiss if I didn't mention through all this, for companies, the post-offer job test. I mean, if you want safety in your program, you test these people up front and you make sure they can do the job to start with. I can't tell you how many people we've tested through the years that failed the test, and that was a work comp claim waiting to happen. So,
Absolutely.
Yeah.
Absolutely. Well, you heard it. If you need any additional training, please feel free to call Therapy South. Also, you can visit the AlaCOMP Safety Library and our YouTube page. Please subscribe and join that. And thank you for joining us.
Thank you.